Hello and welcome to our LinkedIn Live. My name is Elysia Hegarty. I am the Associate Director and Wellness Lead at CPL's Future of Work Institute. And I'm delighted to host the third installment in our Future of Wellness series. Future of Wellness is one of our key services providing enterprise-level health, safety and wellness solutions to our clients. It's delivered through our Future of Work Institute and expertise across CPL Group, one of which is Servisource. And today I'm joined by my fellow colleague and collaborator, Declan Murphy. Declan is the CEO of Servisource, who are specialists in healthcare staffing, home care training, managed staffing, occupational health, health screening, and medicals. And Declan founded Servisource Workforce Solutions in 2000 and has built the business to an annual turnover of 30 million. He leads a team of over 100 permanent staff across Ireland and the UK and has extensive experience in dispute resolution, the management and investigation of workplace incidents and employment matters. Welcome, Declan.
Hi, Elysia. Delighted to see you again. Delighted to be here.
That's an impressive bio.
Thank you.
Yeah, really excited. Yeah, really excited to be chatting with you today on this really important topic. And I know it's something we're both really passionate about. For those who are maybe just joining us, on our last two episodes, we spoke about some wellness trends that we're seeing at the moment. We spoke about wellness design and engaging employees and how that's changing now in our hybrid model. And in our second episode, we spoke about, with our tech partners in Peel, about the evolution of technology and the use of data and measuring the impact. And another major trend that we're seeing at the moment is the employees' desire for more personalized wellness solutions and ones that are aimed specifically towards improving or supporting their health goals or health concerns. And this is really driving a change in the design and delivery of wellness programs. And I know, Declan, you and your team are seeing this firsthand. Tell us a little bit more about the role health screening is playing in defining those personalized solutions for employees and the wellness programs.
Yeah, it's a hugely interesting area, Elysia. And I suppose we have to look at it in two contexts. One is pre-pandemic and now what the COVID pandemic has changed in terms of the workplace. And we need to remember that back in March of 2020, 85% of people never worked from home, whereas now more than 90% of people are working from home. So the whole working dynamic has changed. However, that hasn't changed people's perception of health and wellness. And if you look at global surveys, it has been in the top 10 of employee benefits in terms of how employees rate wellness and well-being. And we at Servisource have established a specific division to assist employers to basically measure the health and wellness of their employee population. And that's by carrying out a baseline health screen. And that's hugely beneficial from an employee's perspective because it gives them the chance to establish how their health and wellness score is. But it also gives employers a great opportunity to establish the health and well-being of their population. And then that's the first step in a journey where the employer can then put in incentives such as smoking cessation policies and supports and other types of supports then to bring along the health and wellness score of the population. And we have to remember it's a no-brainer for employees because if you look again globally, they calculate that there is a return on an investment of 3 to 1 in relation to incentives that are put in place. So for every €1 that's spent, there's a return of €3. And that's in the form of reduced absenteeism, greater productivity, reduced stress, and just a better team ethic within the actual business.
Yeah, I completely agree. It's almost something you can't necessarily argue with when you look at those kind of stats and the impact that it has then on the bottom line for the organization as well overall for the employee. And the pandemic has also certainly had an impact on some of the services provided in person. And I know traditionally, or that a lot of the health screening services that you provide are done in person. How has Servisource reacted to this over the last number of months, and what's the plan for the future?
Yeah, again, we had to really pivot when the pandemic struck. First of all, we had to work from home, and thankfully we were really well prepared to do so in terms of being able to host virtual meetings. But we didn't lose touch with our clients, and we were able to continue delivering health screening. We also added to our portfolio in terms of being able to provide things like antigen testing, PCR testing. And this was a great comfort to our clients, because many of them, especially who were involved in production, many sporting bodies such as football clubs, they needed to keep people engaged and keep people on site. And how are they going to do that safely? So we were able to send our mobile screening unit to site and basically take people on appointments in a safe manner, and basically do the health screening, and if testing was required, complete the testing and turn around those results within 24 hours. So it allowed businesses to keep operating under very tough conditions.
Yeah, wow. And as I suppose organizations are starting to move towards considering their, return to work plans, do you think this type of testing will become a key part of managing potential health risks going forward?
Oh, absolutely. And we're seeing it already. The government in Ireland has set September 20th as the sort of date where people are going to have to consider returning to work. I know some companies have put off that decision to January 1, 2022, but it's not too far away. And, we've conducted surveys recently, and it shows that still 50% of the working population have anxieties about going back into the workplace. Over 70% of them feel that, they want to have more space, and they want to be able to be sure that companies and employers are taking the appropriate measures to keep the workplace safe. But then there's a conflict for employers, because if they introduce a hybrid model, they need to be sure that the workplace at home is also safe, and that it's ergonomically safe, and also safe from an employee well-being perspective. So I see lots of challenges, but I see lots of assistance out there in terms of support, and definitely we're learning a lot at Servisource in terms of how to put those protections in place, and how to make sure that the employee and the employer are well looked after in relation to the policies that they put in place in the workplace.
Yeah, no, I completely agree. And I think more often than not, when we talk about kind of that health risk, it's typically associated with physical wellness, and we obviously, as you say, we can't ignore the mental wellness also. And I'm speaking at the HR Employment Law Conference on the 29th of September on the new ISO psychological safety standards. And this is a huge focus for organizations as, you say we progress back into the workforce, into the workplace, and a lot of anxiety. I read something recently as well around the anxieties that we're all feeling now about even just being out in public, going to even social events, things like that. I've heard the Washington Post referred to this as the pandemic flux syndrome, where we are, in the in-between stages between, where we fought the battle, but the war is still on, So a lot of people are feeling this kind of anxiety or depression or lowness. There's a real mixed feeling out there. And the more people I'm talking to, the more I'm hearing a lot of mixed feelings and mixed emotions that go along with that. So, nobody necessarily has the answer, but right now. But I think we all know that it's important to have some of those interventions or policies in place, so that we are supporting people from a health risk, both physically and psychologically, as you say. So I think it's really important. And from a health risk perspective, considering health screening, and that, why should leaders take it seriously? What are some of the benefits, aside from obviously the reduced absenteeism and bottom line? What are some of the tangible benefits to the individual then that are really important?
That's a really interesting question, and it's something that we're working on at the moment, because health and wellness is very closely related to advances in tech. There's quite a number of us have a Fitbit or another device on our wrists where we manage steps, and we were just chatting earlier about family challenges and intercompany and teams challenges that we have in relation to the amount of steps that we would take in a day, and we're still involved in that. Mental health is a huge consideration. I mentioned stress earlier on. Stress just doesn't disappear because you're working from home and not in the workplace. In actual fact, in certain cases, that can be amplified. And what we found is that when we were working from the workplace, we had order and structure in our lives. So, we could go to work, and on the way, we could go to the gym, or on the way home, or we could take a walk at lunchtime. So there was a lot of order there, and we could actually plan our daily lives around that and get our steps in and get our exercises and whatever interests we had done around that time. In actual fact, the burden for planning that out has been just placed entirely on the employee. So, not only now that they have to plan their working day and work around family and pets and all of the other things that are at home around them, but they now have to actually plan in time to actually get some exercise in and look after their health and well-being. It is a fact that a lot of people have sort of maybe forgotten about their annual checkup with the GP, because in many cases it wasn't available to them. And this is why we've put our mobile screening unit on the road, to be able to offer employers the opportunity to, again, gather groups of employees in a safe location. We will provide that location. We'll just rock up on site with the screening vehicle, and we'll actually give employers the opportunity to add that benefit and give that benefit to their employees. And it's not expensive. You think about executive screening programs that are 400 and 500 euros plus. Our plans come in at less than 100 euros per employee. And, it gives the employer a broad portfolio of sort of results in relation to the general health and well-being of the population. But it also gives the employee a very detailed set of results in terms of, their own health and well-being score, and something that they can use then to, manage activities on an ongoing basis.
Exactly. So it's kind of, from an organization perspective, you're taking that output and you're able to almost design a more tailored approach or more tailored wellness program for your employees, having had that data. Obviously it's aggregated, it's anonymized, but then equally as an employee, if I'm getting the results, I know from my perspective, from personal perspective, the areas that I need to work on and the events that may benefit me as such as well, which is really important. And I know you have some interesting case studies as well. You've contributed to life-saving events for people as well. Can you tell us a bit about that?
Yes, absolutely. It's fascinating what you come across when you're actually working with a broad population. And we see in certain industries, for example, truck driving, the construction industry, even office-based activities where people actually aren't very mobile during the day, that health issues can creep up on you as such, and people don't even know that something is becoming an issue. And quite recently, with one particular client, we were carrying out a health screen that included an ECG, and we do an ECG in our mobile unit on as part of those packages. And we discovered that actually one of the employees was having a cardiac event while the ECG was actually taking place. And luckily we were there at the right time and in the right place, and we were able to advise the the employee to seek emergency help, and we got him to the emergency department. And that night, he had 3 stents inserted, and effectively saving his life. So, you just don't know what's there. And again, for very little cost, you can actually add a huge amount of benefit to your employee base.
Wow, I love that story. I think that's just, phenomenal, the impact that, a wellness program can have. And I know a lot of people joining today are, leaders in organizations, and obviously we want our employee base to be healthy and happy, but, do we ever predict that it's going to have a life-saving opportunity for an employee? I just think that is really a phenomenal story to share. And so when we're considering kind of moving forward in the future of wellness, what other kind of trends are you seeing at the moment, or do you kind of predict with health screening or personalized approaches?
Yes, well, I mentioned the relationship between health and wellness and technology. So, we're seeing the major players in this space, the likes of Apple and Fitbit and Google, and they're all very interested in producing devices that help people improve their health and wellness. At Servisource, we have our own health and wellness platform for older persons called Isaac.care, and that allows people to manage their own health and well-being remotely at home by recording things like weight, blood pressure, blood glucose, and we can actually monitor that remotely then, and you can engage your family, friends, clinicians, whoever you need to be able to manage that. So technology and IoT are playing a huge role in this whole space. I do have to give a shout out to our screening teams, because they've worked in very challenging circumstances over the past 18 months. They've been effectively frontline workers, and we all know how amazing frontline workers have been over that period of time. And we've been very involved in the whole COVID campaign ourselves. But, our screening teams have been out there working with clients, in a safe and secure manner. And they've been doing some great work. And as, employers welcome staff back to the office, we're also, engaging with new businesses and new organizations to make sure that that's a safe and productive environment for people to actually return to. So it's great to be involved in a really exciting area.
Yeah, no, for sure. I think it's as you say, it is an evolving area as well, and kudos to everyone who's continued to keep it going throughout the pandemic, which is fantastic. And some other trends that we're seeing as well, also in the AI and tech space, are kind of where AI is evolving almost to predict an individual, to provide, individuals' preferences. So if, for example, my health concerns are related to, I don't know, diabetes or heart health or something like that, rather than everyone seeing the same thing on certain apps, it's leaning more towards more personalized tutorials or coaching or information for people on their specific health outcomes, which is really interesting to see as well. And we're also seeing a rise in things like health coaching or telehealth, as well, where people can get access to health coaches through their technology, and also a rise in requests for things like personalized programs and fitness plans and nutrition plans, as well, which we can provide through our network of health coaches. So it's interesting to see where the evolution of these kind of personalized solutions are kind of evolving and meandering through.
Yeah, and it's a great point, because there is no one size fits all solution to this. And what we advocate is that people start with the basic health screen. And when you carry out that health screen, it gives, advisors and consultants and whoever you might engage afterwards a really good insight into your own habits, your own dietary habits, things like your exercise habits, and that then can be used to design a pathway for yourself to continue to improve your health and well-being. What we also see is that organizations they're sort of sometimes they'll run something that's on an ad hoc basis and don't have a consistent plan. And what we like to assist organizations with is putting something in place that's not just one-off, that happens on a regular basis. And the benefits of doing something like that are huge because, first of all, it builds team. So when you have a STEPS challenge, when you have a health and well-being event, you're often engaging lots of people. You're often introducing a little bit of competitiveness in the organization as well. So we've seen it ourselves internally where we've had teams competing very, very strongly with one another, but it's all in a good cause, and there are great outcomes from it. We had an example ourselves where we introduced the 7-7-7 challenge, and that's where you do 7 activities for 7 weeks, and we measure each one of those activities and we allocate points to it. And it's a really simple way of just building employee engagement, having a great time doing it, but also seeing some really positive outcomes as a result of it as well.
Yeah. And you touched on something else that I think is really important right now that we're seeing as well is lacking in a lot of organizations and contributing to some of the unwellness in some cases is that lack of social interaction. And I think that is really something that people are craving at the moment. We're seeing that anyway in some of the organizations that we're working with, and a lot of the stuff that we're implementing at the moment are activities such as like the ones that you had mentioned there as well, to keep people connected whilst we continue to work apart. I know obviously there's some people who haven't, but it's really interesting. It's a really key topic, I think, at the moment is, well, how can we continue to engage and keep that kind of social interaction that we're all really craving right now?
Yeah, that's right. And, we've gone to great lengths at Servisource to understand a lot more about our employees, particularly when they joined the business initially. And we've introduced what they call a CEO SLT induction. And that's where each new employee is invited to tell us something new, tell us something that we might not already know about them. And as part of that process, you'd start to learn about people who have really, we've had bungee jumpers, cliff divers,
wow.
High gliders, and then we've had people who just like to get out for a walk with the dog in the evening, who like to play a game of football. But the theme through it is they're very interested in social engagement, and they want to do things as part of teams. And what we've been able to do at Servisource is to, not let the whole virtual world pull that apart. We've run, it's difficult, but we've run several Zoom events. And the 7-7-7 challenge last year was actually run online as well. So we had to post videos of the activities that we were doing just to prove that we were out running as well, and that it wasn't the dog that was running with the Fitbit.
Tie your Fitbit to the dog and off you go. Yeah, exactly. No, this is fantastic, Declan. Before we kind of finish up, I'd love to know, what are your kind of top 3 pieces of advice for any kind of leaders that may be listening right now and want to kind of implement or think about it wellness from a more personalized perspective? What would be your kind of top 2 or 3 tips?
Well, the first thing is, don't put it off. There's never a right time to start. The time is now, basically. It's a no-brainer. There are studies worldwide that show that the return on investment is there. And I'm not just thinking about it from the cold financial sense. I'm thinking about it from the whole engagement sense, the team building, the team ethic, because when we have a fit and productive team, there's high levels of engagement and positivity there as well. So it can only have a positive effect on the business. we're very conscious that employees have the choice with them, and employers are spending a lot in terms of employee engagement. For very little outlay, you can actually put a very effective wellness policy in place, and that contributes hugely to employee retention. So don't put it off.
Brilliant. Well, listen, thank you so much for your time today, Declan. It's certainly an interesting space to be in. For those of you listening, if you want to learn more about the future of wellness and our services, please click the link below and download our brochure, or reach out to either myself or Declan directly. So thank you so much for being with us today.
Thank you, Elysia. Thanks very much.